It can be very confusing to understand the differences between alternative medicine, complementary medicine, and integrative medicine. At the same time, it's very important. Hi, I'm Professor Noah Samuels. I'm an integrative physician and the founder of the Integrative Medicine 101 site. For each of these three settings, it's very important to understand what the treatments are that are being provided, where they're being provided with respect to the conventional medical setting, how they're being provided vis-a-vis conventional medical practices, and an important point, who is providing the treatments does not necessarily define the treatment setting. So let's start with alternative medicine. What is it? These are treatments that are not evidence-based, they're not proven, they're not studied. Very often they contradict conventional medicine. They're not being practiced in the conventional medical setting, but rather outside it, in a private practice most often. How are they being provided? Instead of conventional medicine, and very often negating conventional medical. Okay, complementary medicine is a much more familiar setting. The treatments being provided are evidence-based acupuncture, touch therapies, mind-body medicine such as yoga, meditation. However, the treatments are being provided outside the conventional medical setting. So for example, I'll go to my family doctor, I'll say my back hurts, he'll send me to the orthopedic surgeon, the physiotherapist. Everyone is working within the conventional medical setting. However, if they send me to an acupuncturist, the acupuncturist in the complementary medicine setting is working in a private clinic or in a separate clinic outside of the conventional medical setting. The treatments, however, are being provided parallel, most often with the knowledge of the conventional medical healthcare team. Integrative medicine is the highest level. I'm an integrative physician. The treatments that are provided in this setting are evidence-based, guideline-based. The treatments are being conducted and provided within the conventional medical setting. I work in a conventional oncology daycare center where patients are getting chemotherapy and radiation therapy, and I work with the conventional oncology team. We work together. They send me patients. I send patients to them. We teach together. We do research together. And a very important point, if someone is a physician, an MD, who's doing alternative medicine, not evidence-based, outside the conventional medical setting, that is alternative medicine. And the fact that he or she is a conventional MD does not mean that what they're doing is integrative. At the same time, there might be somebody who's not a physician, for example, the reflexologist, who's working in the conventional medical setting with the conventional medical team. That is integrative medicine. For more about this, please click on the link below.